Hi, this is Dr. David Greene with the Arizona Pain Network, where we bring you anything and everything education for pain management. Today the topic is 5 key points for facet arthritis treatment. Now, very quickly, here's your spine from the back. There's your coccyx, your sacrum, and then the lumbar vertebrae. These are the facet joints, these small thumbnail-sized joints on either side of the spine. There's one, there's one, there's one. Okay? All right. Now, they have cartilage and they're subjected to arthritis similar to hip and knee joint. All right. So, here's the 5 key points. First of all, if you have facet arthritis in one joint, most likely you have it in a bunch. Okay? They're tiny joints, but think about it. All the facet joints bring you the ability to move a lot, with your back. So if you have arthritis in one, most likely you've got it in multiple. Okay. Now, in addition, this is not a second key point. I'll just make it a 1B. Is that even though it's a small thumbnail-sized joint, it can cause major league pain. Okay. So just because it's a small joint doesn't mean it isn't causing big-time pain. Key point number 2: surgery for facet arthritis alone, bad idea. All right. They've been trying for many years to develop a facet replacement, just like a hip or a knee replacement. It's just not there yet. Okay? Nowhere close. They've been trying with various devices, but the facet joint is small and it's complicated. There's not a lot of fixation points around it. It's not like you can cement in components like you can for a knee replacement. It just isn't there yet. So to have surgery for facet arthritis would really entail a fusion. Anytime you do that, you increase the stresses above or below. It can create more problems than it helps. All right. Now, the third key point is what's called a medial branch block. Is a procedure that's often done by pain doctors, injecting medicine around the arthritic facet joint to see if it gives pain relief. If it does, you know that joint is a cause of the pain. But what a lot of people don't realize is that the average pain relief for a medial branch block in studies is 3 months. It's very impressive. So if you can get 3 months of relief out of that, and then maybe get it repeated, for another few months, that's like 6 months of pain relief, which a lot of people think that medial branch blocks only work for a week or 2. No, that's not the case. It can work for 6 months. 3 months plus 3 more months. Now, if the pain relief wears off from a medial branch block, that brings me into my 4th key point on facet arthritis treatment, is a radio frequency ablation procedure can provide 12 to 18 months of consistent pain relief. It can really decrease the amount of medications that you need, increase the activity that you're able to do, and 12 to 18 months is a very impressive time frame when you're in the world of pain management. Okay? Very low risk, very high reward for that procedure. Now, the 5th point is if you have a radio frequency ablation and the pain relief wears off after 6 to 18 months, they've done a study looking at a repeat radio frequency ablation. And what it showed is that you can expect to get the same pain relief as you did the first time. So all is not lost. You can just have it done again. Okay? You can avoid surgery, decrease the amount of medications you need, not have to be depressed and anxious about the pain that you were experiencing on a daily basis. It can really help. So there you have it, 5 key points for facet arthritis treatment. Arizona Pain Specialist has 4 locations throughout the valley. They accept over 50 insurances. They have double board certified, fellowship trained pain doctors who do all the treatments for facet arthritis. They also have chiropractic treatment as well as acupuncture and spinal decompression therapy. Okay, call today at 602-507-6550 and visit us on the web at preferredpaincenter.com. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.